Good morning. Thank you, Governor. This is an exciting week. While we're just beginning to get the vaccine to Iowans, thanks to the thoughtful planning by our IDPH team and local public health partners throughout the state, we're poised to move quickly to protect Iowans from COVID-19. As the governor mentioned, now that Iowans are starting to get vaccinated, we're committed to sharing progress and publicly reporting on our state's progress. As we likely have another vaccine that will be available soon, Moderna, FDA advisors will meet tomorrow, and we anticipate that things will move along a similar path as to what we saw this last weekend with Pfizer approval. A flurry of activity will occur over the weekend, and if things go as planned, we could start seeing Moderna in this state on Monday. This is all great news. However, I want to caution that we are still in the very early stages where supply is limited, and understandably, Iowans want to know what we expect next and who will follow the initial priority group of healthcare workers and long-term care residents and direct care staff. You may recall last week that we announced the Infectious Disease Advisory Council, or IDAC. This group is working to develop vaccine distribution guidance and prioritization of populations early in the vaccine response. This group brings together clinical and ethical expertise from across the state, including university leadership, infectious disease specialists, local public health agencies, key provider associations that represent vulnerable populations, and IDPH and other agency staff. I'm pleased to report that IDAC has met twice and had thoughtful and meaningful conversations. From their first two meetings, the council discussed initial sub-prioritization for populations in Phase 1A, which are long-term care residents and those who care for them, and hospital staff. In these settings, all clinical staff do not have the same risk of exposure. The council discussed within those first groups all roles, including those on clinical rotation, students, and other non-clinical staff who are equal parts important to delivering care. IDAC is finalizing those recommendations, which should be available next week. When IDAC meets next week, they will begin to focus their discussion on prioritization for Phase 1B, critical infrastructure, which includes those who work in other congregate settings like schools, food supply, corrections. You can see these are very difficult decisions. Again, this next prioritization will be focused on work settings, and I'm tremendously thankful to our IDAC members who are taking these conversations head on, speaking freely, bringing their expertise to the decision-making process, because these decisions cannot be made lightly or easily. I'm confident that we have the right people at the table for this challenging effort. To assist in their work, we're reaching out to advocates, stakeholders, and employers throughout the state for written input. The council will use this information to inform and guide their discussions. Minutes from the meetings and their recommendations will be posted on our agency website. And as the vaccine becomes more broadly available, it's important for each of us to be thinking about when we'll take the vaccine. I'm eagerly awaiting to get my vaccination. I don't have a date set yet, though I can share that our residents and frontline staff at our resource centers and mental health institutes will receive the vaccine first in the Department of Human Services prioritization, we believe, later this month. This will be quickly followed by prioritization of our DHS social workers who have remained on the front lines throughout this emergency response, continuing to keep in-person contact with the families they serve. I have full confidence in the efficacy and safety of the vaccine and believe it is key to turning the tide of the pandemic. While planning for the logistics has been an effort unlike anything I've ever seen in my career, we know that communications will be critical to this next phase of the effort. While we're working on a robust communications plan to encourage Iowans to get vaccinated, this will focus on sharing facts and information to ensure Iowans know that the vaccine is safe and effective. We'll focus on instilling in Iowans confidence that I have, our IDPH team has, and the medical and scientific community have around this vaccine. It is safe and it works. We will also provide regular updates on our progress in Iowa, and we'll work to reach vulnerable populations, including non-English speakers, refugee communities, those we know have historic hesitation around vaccination, and people with disabilities. And as I said, this communication effort will be a critical part of our response. With all of that, I would be remiss if I didn't ask Iowans to maintain significant progress on the vaccine front. We have to keep up our fight around using simple public health measures. Wash your hands, socially distance, stay at home if you're sick, and wear a mask.